Hello, everyone. This is Eric Laser, and welcome to our live recording of Bright Spots in Healthcare, produced by Shared Purpose Connect. We bring leaders together to not only inform you, but also unearth successes, bright spots at health plans, hospitals, and other healthcare-related organizations around the country, because our goal is to identify as many bright spots as possible so that you can determine if the ideas shared on this episode can be applied at your organization. We believe this approach of finding a bright spot and cloning it is the most effective strategy to improve healthcare in our lifetime. Encourage you, if you haven't already, to subscribe to this podcast. You can also follow us on LinkedIn, Bright Spots in Healthcare, where we put all kinds of clips to the shows that you'll get in your feed that could give you quick little snippets throughout the day on some of the incredible bright spots that our guests provide each and every week. And my guest this week is going to provide a number of those bright spots. None other than Sonny Goyal, Senior Vice President, Diversified Business Group, and Chief Strategy Officer at Blue Cross and Blue Shield of North Carolina, better known as Blue Cross North Carolina. Sonny, welcome to the show.
Thank you for having me here.
I want to give folks some background on you just before we get going here. So you're running the Diversified Business Group, you're the CSO, you're also responsible for thoughtfully guiding the organization as it seeks to achieve sustainable long-term growth by enhancing the Blue Cross North Carolina business and identifying opportunities to expand beyond inorganic growth. We may have to explain what that means later on. Among your other responsibilities, you're accounting for managing and maturing the company's best-in-class partnerships and assets, shaping Blue Cross North Carolina's short-term goals and long-term strategy, portfolio planning and prioritization, corporate development, and utilizing strategic intelligence to improve the experience of stakeholders across the state. That is a lot. Just to prove to everyone that you're qualified, prior to coming into this role, you served in leadership roles at other leading companies in healthcare, venture capital, and finance. Most recently, Executive Director of Corporate Strategy and Development at the Advisory Board Company. And prior to that, you led mergers and acquisitions for Highmark, Blue Cross, and Blue Shield. So let's talk about, before I ask that first question, just define for us inorganic growth. And then I have a couple of questions planned for you where you could highlight some of the cool things you're doing down there in North Carolina. And I say down there because I'm up in Boston.
Makes sense. It's much warmer down here than up there. I'll say that. Inorganic growth is a fancy way of saying mergers and acquisitions. When we think about not your standard organic growth of how do I add one member to another member, or a customer by customer, but really thinking about how can I go leverage my balance sheet and acquire and bring things to bear in a faster way.
Right. And now the ideas that you're going to share, they are some of them organic, some of them maybe inorganic, and I'll maybe ask you to clarify how you're approaching each so that folks could sort of take notes and create their own blueprint on how to do what you guys do. When it comes to like this show, we do a lot of interviews around how organizations are going about mitigating social driver risks, social determinants of health risks. And a lot of the initiatives are working, and some of them maybe not working as well as they can be. I know that you guys at Blue Cross North Carolina are looking at food insecurity in a slightly different way than most. And I wanted you to tell us a little bit about how you're approaching food insecurity in North Carolina and how that's working out for both the business and, more importantly, the consumers you serve.
Yeah, happy to do it. Again, thank you for having me here, Eric. I really appreciate it. It might take a half a step back and just say this. We're focused on several major non-medical drivers of health, is what we call social determinants of health: food insecurity, transportation, social isolation, safe and adequate housing, et cetera. Because I think these things are really critical to ensure that people live their best life. I mean, that's the summary of this stuff. The thing is, here at North Carolina, though, what we don't want to do is just simply create a new benefit and hope that it'll engage enough people and be successful and work. And frankly speaking, there is no evidence-based drivers of health map to follow. And so our strategy has really been to build our own base of quantifiable evidence through test and learn models. Right. Once a concept is proven, then the idea is we scale up that model and ultimately the goal is to expand on those ideas through our benefit offerings and to make sure that we're hitting the entire state. To your point, Eric, food insecurity is one of the ones I'm most proud of. We launched a 6-month program for members with type 2 diabetes who have also identified as being high risk for food insecurity. And effectively, we sent them twice monthly fruit and vegetable boxes, and we provided them with health coaching by phone every week. I had about 555 members complete the program, and really interesting statistics came out of this. Let me give you a couple of them. Obesity reduced from about 69% to 63%. It's really impactful. The percentage of members scoring above the US average for physical measures improved from 51% to 63%. The percentage of members for mental health measures improved from 68 to 79%. We showed significant medical expense reduction, which is really great. I will comment, actually, we saw some pharmacy costs did rise, however, so we're trying to peel back some of that information. But in total, medical expense dropped pretty significantly. And we're in the process of currently analyzing the 6-month period after the pilot to determine the long-term implications as well. But short-term stats look fantastic. Probably the biggest stat, though, Eric, I might share with you, and it's the one I'm the most proud of, is the number of members who are in the program who self-identified as food insecure dropped 50% at the end of the program. That's a big deal. That means that those members, those people, felt like they were being taken care of and getting what they needed. That's really, really critical and super energizing for me. Frankly speaking, that's just one pilot. There are a number of others in process, as I mentioned. I think some others we're looking at right now are companion support to reduce isolation, targeting members who might be at risk of falling. That's a big one for us. And actually looking at home security is another one as well. Again, I think this is really critical work, but we're really approaching this in a different lens of just, let's not just throw another benefit out there. Let's actually test, let's learn. We're going to make some mistakes, but we're going to learn. And I think we've learned quite a bit through this process. And by the way, Eric, just last thing I'll say here is you can see the results. We did publish them in the New England Journal of Medicine Catalyst in the spring of 2023 this year, the proof of concept. So all the data is inside there.
It's great. I want to review some of the data points you highlighted. In particular, one, I'd be remiss if I didn't ask, you said significant medical cost reductions. Can you get more specific than that, or you don't have that?
Yeah, so there's a little bit of noise in the data, but what we're seeing is greater than $60 PMPM reduction in costs of care.
And when you talked about there was an increase, and I appreciate the transparency in pharmacy costs, is this like GLP-1 increase in pharmacy costs or something a little bit more mild than that?
Yeah, our sense is, and again, apologies, I don't have the perfect data right now. Our sense is not purely driven on GLP-1, though that could be a piece of it. Our hypothesis right now is that it's actually more likely attributable to the fact that we're getting greater medication adherence.
Yeah.
So it's actually not a negative to see the costs go up, but they did go up, and we need to figure out why.
Right. Okay, so I just want to summarize. We saw a huge reduction in obesity, not a huge, but a significant. A major improvement in physicality. I forgot the exact word you used, but 51 to 63% in physical
health measures. That we measure. Yep.
A similar improvement in mental health, which is awesome, and a major drop in food insecurity.
That's right.
It's awesome. So this seems like a fairly impactful program, understanding it's still small. Any thoughts on some of the core components of the program that's made it as effective as it is?
Yeah, I think first one, to be frank with you, is just a willingness to fail. This was something that we were very passionate about, but also, as I mentioned, we didn't just try and launch out a benefit here. We thought, what do we believe people need in these communities? And it was a hypothesis. And fortunately, on this one, it really worked out nicely. And so having a mentality and a perspective that, hey, let's give something a chance. If it fails, but let's make sure we learn and we pivot quickly. I think second was finding the right and appropriate partners to kind of help us institute this piece, both in terms of helping us engage the members, but also deliver the food. Right? We had a partner who delivered the food to these members, and you want to make sure that it's getting there timely, it's effective. We're not making any mistakes inside of this. And I think third is just making sure that we're providing the resources and education to those members so that they can actually do something with the food. I mean, look, the reality is there are many folks out there who you can drop as much food as you want, but if they don't know how to cook it, they don't know how to eat it, it's not going to do you any good. And so providing the appropriate education resources, as well as the call services that we had, really provided that kind of critical infrastructure for the members to be successful within the program.
It's great. And it's certainly a core component to any successful value-based care strategy. So I want to talk a little bit about value-based care and that journey, my words, not anyone else's, for the health plan. I think, starts with benefit design and sort of ends with that provider relationship and partnership. So how are you guys at Blue Cross North Carolina approaching provider partnerships so that you're able to maximize the power of the local providers and truly implement it in a much larger scale, just overall high quality valuable care?
Yeah, great question. We've been on this journey for quite some time, and that journey has really been a big piece of it has been, how do we move past that traditional adversarial relationship between payers and providers? And we launched our signature value-based care initiative. We call it Blue Premier, but it's really a payment model that rewards health outcomes rather than the volume of care delivered. And a key piece of this is that it's truly collaborative. Right? We're not dropping in and saying you must do these things. It will never succeed in a value-based care world. The goal is to effectively share in the rewards and the savings, but also share on the downside. If both parties aren't performing well, we have to share in the downside as well. I think we've been really successful with the program. We have our 12 largest health systems in the state, over 800 independent primary care practices in the program, and about 65% of our medical expense is flowing through this Blue Premier product, which is fantastic. To give you some numbers here, we launched this in 2019. It has generated $650 million in savings, and the providers in Blue Premier have earned over $430 million in shared savings since the launch. So they're winning, we're winning. It's a big opportunity, and really, ultimately, people, our customers, our members, our patients are winning. Beyond just the financials, we've seen an 18% reduction in unplanned hospital readmissions in this program. We've seen a 15% increase in the number of members who took steps to manage their blood pressure compared to 2021. And the number of colorectal screenings has really increased, which is fantastic for us. I think the second part of your question, Eric, is around the local part of it, and in my opinion, the independent physicians as well. And so I think it's important. We spend a lot of time and energy in there. In our opinion, primary care physicians and even APPs, they're a critical backbone to our healthcare system, and particularly in rural parts of our country where they really may be the only option for so many people. Primary care is just perfectly positioned and uniquely positioned to address root causes of poor health and to create paths of wellness. So to kind of address that, we've done a lot, certainly supported and invested behind a lot of our local organizations, including HBCUs, Duke, UNC, to support training, retraining, and in the increase of our workforce, our clinical workforce, but perhaps one of the most incredible initiatives from my perspective, and one that I'm really proud of in North Carolina, we called it Accelerate to Value. It was a program we launched during COVID-19 pandemic to effectively pay primary care practices at pre-pandemic rates to keep them financially sound when patient traffic really dropped off, right? I mean, this was early 2020. No one knew where the pandemic was going. We didn't know much, except that people were staying indoors and not engaging with most folks, except for maybe, and including their primary care physicians, right? And so this program was there to really help stabilize a critical piece of our healthcare continuum in a time of uncertainty. And so we basically went to all those practices and said, hey, if you will move into a value-based care contract, we will hold you for 2020 and 2021 equal to your 2029 reimbursement from Blue Cross North Carolina. That went a really long way with hundreds of physicians who joined into the value-based care world. And I can tell you that program worked out beautifully as we clearly know the pandemic panned out, but it really strengthened the relationship with those independent providers at a deeper level than you could possibly imagine. Because the reality was we were there for them when nobody knew what was happening in our markets.
Well, there's a lot I want to summarize. So let's back up so make sure everyone captures the stuff. First of all, Blue Premier has some pretty impressive results, $650 million in savings, more than $430 million in shared savings for the providers, $650 million in savings in medical costs to the plan, 18% reduction in unplanned hospitalizations, blood pressure reduction, increased colorectal screens, so HEDIS measures, kind of check, check, check. And so that program, partnerships with local organizations, including HBCUs. For those of you who don't know that, it's historically Black colleges and universities, right? In case you don't know, local training, all of that. So that's super, super important, super impressive results. And then, and I think I'll ask you for the takeaway here. I have thoughts on it. This accelerated value program that you implemented sort of right around the pandemic, and where you guaranteed your providers, especially these independent providers, compensation equal to what they were getting, even though no one was allowed into their offices and they're still probably figuring out how to spell Zoom. So all that happening, and so that sort of builds an incredible relationship bond and keeps those provider practices pretty solvent into the long-term benefit you're realizing today and beyond.
That's right. You said it better than I did, Eric. That was perfect.
So I think the takeaway, because hopefully we're not going to deal with another pandemic anytime soon, hopefully. So I think the message for a leader of the health plan right now is to look out into the future and see how you can invest in the future with your providers and find other opportunities to invest in providers today for future benefit and future strong relationships, and figuring that out today. I mean, I think that's the message, and I'll ask you to comment on that and see if I got that.
You nailed it. I mean, that was the reality of the situation, and I hope we don't have another pandemic anytime in our lifetimes. But the reality is, I think this program is extensible to many other things that we all do in the insurance world. It's about taking a leap of faith and putting out an olive branch out there to effectively say, hey, I'm going to take the first step. This could cost me a lot of money. And this can really impact our rates and our ability to survive as an insurance company. But we knew it was the right thing to do for our communities, and we knew it was the right thing to do for our providers. And our theory was that it would pay off dividends on the back end of this. We get more providers into value-based care, and we build stronger and stronger relationships. And I can tell you, we have knocked that one out of the park, Eric.
So in light of the strong partnerships you've built in North Carolina, I'm wondering if I'm building a value-based care model that I want to be super successful in another area of the country, like how would you go about starting? Like what would be the first priority as far as a strategic approach? Is it that partnership, and how would you design it?
Yeah, look, if I was building one from scratch or really going into a new community, I'm going to steal somebody other words that I've heard out there, but payvider is a commonly used term. And I would be suggesting that folks really try and build, through partnerships, acquisitions, you name it, right, a localized payvider, an organization that is that's built into the community, that is leveraging local assets and is a high level of degree of integration with local physicians and the systems that are in those markets. Plus, I would make sure that you built an infrastructure that really helps you as the plan, as well as your provider side of the house, to deeply understand an individual at a person level, not at a population level, as well as helping that individual really make decisions and navigate and better understand healthcare at a much better level. I think those are the core components that I would say would really strive to make a better value-based care product if you go into one. It will allow you to build a more affordable product. It will create far more exceptional care for the member, for the patient, and it'll leverage really that high-quality local delivery asset that's really going to take you to the next level. That, in my opinion, is it. Now, you might be able to go acquire some assets, do some other things, but I think being a hyperlocal payvider is the answer.
That makes total sense. And I think it also provides a nice segue for me, because I want to get into, North Carolina's, by East Coast standards, not a small state from a geographic standpoint, at least. How are you as an organization getting local and getting to meet all of your members and the community at large? How are you approaching that as an investment, as an organization? How are you approaching that as part of your culture at Blue Cross Carolina? Tell me a little bit about that and how that's working out.
Yeah, we're a 90-year-old company. We're really proud of that fact. And we've been based and served North Carolina for that full 90 years. And so most of our employees are North Carolinians. You would think that would be enough, but it's not. And so our leadership really tried to focus in on, okay, what should we do to better understand our communities? And for reference for your listeners here, we have about 100, we actually have exactly 100 counties in the state. And there are vast differences across every one of those, whether you live in rural, isolated areas to major metro areas like a Charlotte or a Raleigh-Durham market. It's very diverse, and it can take you a long time to drive across the state. An interesting statistic I'll share with you is I saw this, that North Carolina has the second highest population per capita in rural areas, only second to Texas. And so that's super interesting in terms of where our population is, and really mind-boggling in a lot of ways. So we thought about it quite a bit. And about 2 years ago, we launched what we call our Extra Miles Tour to visit all 100 counties in the state. And again, you might be asking yourself, well, you're North Carolinians, why do you need to do that? We live in certain counties. We spend most of our time in certain areas. I mean, there are cities in this country. When I lived in Pittsburgh, I wouldn't go across a bridge. So you talk about traveling from county to county. It's very important that you do that. And so a set of leaders set out to go visit all of these counties. They spent time speaking with our local employers within each of those counties, educators, business leaders, elected officials, community organizations, HBCUs, students, you name it. And it was really a great track. We just ended it, and it provided unbelievable insights on the ground of things that are the most pressing challenges across our state. A couple of things I'll hit on. One, consistently, healthcare is not affordable, and healthcare costs are too high. Not a shock for most, but that is what we heard consistently. Second, you may find this super interesting. In 30 of the 100 counties in North Carolina, they did not have a practicing psychologist. In many of the counties, we didn't have full-time support for childcare for folks going to work. And probably one of the most compelling stories on the visits was they actually had a visit to Haywood County, and it's in the western side of our state. And it actually coincided, coincidentally, with the closure of a paper mill there, Pactiv Evergreen paper mill. The mill had been in the region for about 115 years. A number of our company leaders, though, just happened to be at Canton, and they actually heard the mill's whistle blow for the very last time. And we had the opportunity to talk to the local residents, to the employees of that paper mill, the mayor, many elected officials, and we made some really interesting decisions, but it also had a lot of impact in folks' lives. The first one was in the short term, we made a $500,000 investment to provide economic recovery grants, because I can tell you this mill was a critical part of the community, and losing it really is going to hurt that community. But we also hosted a number of in-person events to really help those former mill workers connect to COBRA, ACA, Medicare, Medicaid, and any other resources that were available to them at that local level to really support them on this. I was thinking about the proof for the success marks here. Now, I'm sure a number of these folks bought our insurance, but the reality was that wasn't really the point, right? We wanted them to know that we cared about them, that we cared about their community, and that this was far more important than selling a product in a tough time because, again, we've been here for 90 years. We plan on being here for another 90 years. And building a relationship where you're just trying to sell them a policy is not, it's just not going to last the long run. And so we knew that this was super important. The dogs again, they are loving life today. So look, the last thing I'll say is this. Next phases for us, we do plan on launching and taking these learnings and using them to create more collaborations within that, within each of those regions, within each of those communities and those counties. And we're trying to figure out what our CEO likes to call it, the coalition of the willing. Who can we partner with to address many of those very, very local issues that they deal with? But we're really excited about it. While I said the tour ended, we are going to kick off, we'll call Extra Miles Tour 2.0 next year, because we really do want to build upon that success, build upon those learnings, and continue to build those relationships with all of our communities.
Well, I love that. I mean, it's basically, you do good for others and it comes back to you in unexpected ways, whether they end up in a Medicare, in an ACA product of yours, whether you're just keeping people healthier and keeping the community healthier, which in turn will probably end up helping the business, especially since you are the dominant player in the state. I think that's super awesome. And hopefully there's organizations that have the funds to do an Extra Miles like tour within their communities, within their markets, to get closer to the community, because you learn a lot of market research too, right? You mentioned, before you share that moving story about the paper mill, you talked about finding out, of course, members or consumers, I should say, healthcare is hard to pay for, lack of psychiatrists in just about a third of the counties, lack of child care. These are things that potentially the health plan can work with local providers and the coalition of the willing in different areas of the state to mitigate some of those things, which will come back to the business as well.
Yeah. One population, Eric, I'll just call this one out. We have a county that we went to visit, and they had a very large portion of workers from South America. And interestingly, what we found out through that process was there's only one physician in that entire county that spoke Spanish.
Jeez.
Right. And so you start to realize that, my goodness, we need to figure out how are we going to take care of these people, and how, because they're supporting the community there too by doing a lot of critical work for that community. And so, you would never get those kinds of learnings by sitting there looking at the data, right? You'd never understand that. So anyway, just thought I'd throw that out, Eric. It's there's a lot of compelling, great information we've gathered to really try and get as local as humanly possible.
Yeah, this has been great. I mean, we have the food insecurity program. We talked about Blue Premier as well as the Accelerate to Value, which is sort of beneath that little bright spot now, the Extra Miles Tour, a little bit of a blueprint that you gave us for the VBC programs. A lot of good stuff here, Sonny. I appreciate it. How can people listening find and learn more about these cool initiatives going on in North Carolina at your organization?
Yeah, look, we're a pretty friendly organization. The reality is not everyone's going to buy our insurance. And so happy to talk to competitors, but also happy to talk to anyone who's not a competitor to share these things, because the reality is we are a nonprofit, mission-driven organization. So if I'm helping you help people, I'm helping push our purpose. Reach out to me. Happy to take those questions. Certainly some of this information we've put into some statements out there. And as I mentioned, we also did publish that study and that pilot in the New England Journal of Medicine in the spring of 23 thing as well. So you can find some of this information there. But if there's other detailed questions folks have, please reach out to me. I'd love to talk to you.
Yeah, purpose is good. Shared purpose is better. So I will, I'm going to do some things that your PR team wanted me to do. So if you want to check out their blog, we'll put this in the show description if you're listening on a walk or on a ride right now. bluecrossnc.com/blog. And then you could also search Blue Cross NC on X, aka Twitter, YouTube, Facebook, Instagram, and TikTok to find out more. And I think you could probably search Sonny Goyal on LinkedIn as my guess, right?
Absolutely.
Well, thank you, Sonny, and thanks to everyone everyone who's listening. I know when you look at a problem that may be hopelessly complex, I suggest to you that rather than looking for this large, massive solution, this large, massive cover to cover a big hole, that you actually pause and look for the little things that are working at your organization or organizations in our industry and figure out amongst all the chaos how to take those tactics, those programs, and figure out if you could scale those, because that entire sort of solution strategy can be a way to address and successfully overcome the toughest challenges you have, like some of the examples that Sonny just gave you at Blue Cross North Carolina. We hope you use the bright spots shared today to inspire your thinking, maybe even copy a couple of them at your organization. We produce this show for you. Remember, this is your Bright Spots in Healthcare podcast. Take care, everyone.